our talk this time about advanced knowledge test MCQs. This is a part of written MCQs of the MRCGP international exam. So, what is AKT? What is it about? What is it testing? So, it's using mainly single best answer. So they will give you a lot of options, and they will ask you what is the single most best answer. And it covers 80% of it cover clinical medicine. Another 10% will be evidence-based medicine and statistics, medical statistics, and another 10% about organizational and administrational topics and ethical topics, things like that. These are the main areas covered. As you can see, 80% here are internal medicine, then and pediatrics medicine, few obstetrics, psychiatry, some infectious diseases and public health, evidence-based medicine and statistics, and ethical issues and primary care organizations. So these are the areas which are covered or being asked in the advanced knowledge test. So, as I said, these are the topics which could be clinical, divided into clinical or non-clinical. As you can see, non-clinical including public health issues, ethical issue, medical statistical problems, and so on. They love to give one or two questions or some few questions about statistical issues in medical practice regarding the sensitivity test and specificity of a test, relative risk and relative risk reduction, absolute risk and absolute risk reduction, and the number need to treat, and screening tests and why and what are the criteria of screening, blah, blah, blah. So they love these areas to ask, in few questions, one or two or three. Before the exam, candidates should review the newest guidelines, especially NICE or NICE. In guidelines, particularly review the hypertension guidelines, diabetes guidelines, anticoagulation guidelines, asthma and COPD guidelines, cancer referral guidelines, and screening guidelines. So just before the exam, look for the new guidelines in this area, especially NICE. So in the hot question, mostly they will ask, what is the next best step you may do? What is the most appropriate management? What is the most likely diagnosis? What is the best investigations to do in primary care? When to refer? And they will give you options, then you have to answer from that. In this test, AKT, MCQ's question, you need to read the last, many experts advise you to read the last line first. Because if you read the last line first, then during reading of the whole question, you will concentrate on the subject of the last line. Because now in the last line, for example, the question will ask you about differential diagnosis. So while you read, you concentrate on differential diagnosis. That will help you. So read the last line first. Or if the last line is about the best test you do, so while you read, you concentrate about the best test in the context of the question. Identify key information, desired category of question, which is it a question about treatment, about investigation, about differential diagnosis, and so on. And you might need to predict the answer before reading options. So, for example, if the last line is what is the most appropriate next management step? So if you read this as in the last part of the question, then help you focusing in the while you read the scenario in the management step. Okay, that's very helpful reading the last line. Meanwhile, there are key informations they give you in the question. For example, if they give you a story of a 60-year-old man, so it is different from a story of a 20-year-old man. And if the story of about a man is different from a story of about a woman. And if you give you a story of a diabetic, except it's different from a story of a patient who was absolutely normal with no history of diabetes, and so on. So this information you can underline them. Means this red flag informations while you read the questions. They don't give you this information just for nothing. So you have to put them into account. So, and if they write you vital signs are normal or abnormal, that's important to notice. Just before the exam, in the last night of the exam, or on the day of the exam. In the last night, you need to sleep well and early, eat light meal, and avoid coffee and other drinks. On the same day of the exam, take a light meal, like a light breakfast, but you need to arrive early, don't come late. During the exam, read the question carefully and eliminate wrong answers from your side. Manage your time, because if you waste your time in one difficult question, you give it more than the required time, then this will be at the expense of other questions which you might know better than the difficult one. So try to manage your time properly. Some candidates will erase the correct answer because they are stressed when they review, and then they change it because they are stressed. So try to avoid this habit. Let us take some examples of some questions which appear in the exam and try to find answer for it. This Mr. Muhammad, 55-year-old. So this age is a landmark. Man is also, diabetic is also, okay. They gave you a big weight, not just for fun, for a purpose. So all of this you have to remember, and also they gave you a very high hemoglobin A1C, okay, and that he was only using glucophage twice daily during these 5 years of diabetes. So they ask you, what is the most next step? And you have to select one of these. Are you going to add glucagon like peptide, or you are going to add insulin or dimacron, or you are going to increase glucophage dose? So what is the best or the most appropriate answer in this context? Or you are going to increase advised lifestyle? All of these could be correct answers, but they need the most appropriate one in this special scenario. So in this special scenario, this patient has 5 years, not 10 years or 20 years. So perhaps it's better to give him a chance for uh, anti-diabetic medication, other anti-diabetic medication before you could add insulin. So the best option here is B, which is adding GLP-1 receptor antagonist. Because the patient he gave you high weight, so this one, GLP-1, is known to help in weight reduction and also help in glycemic control. Okay. Insulin with this scenario of only 5 years is not recommended at this time. But and also he was only on glucophage. He didn't try other options. So the best one might be B. Let's take another scenario. This is a young man, a young female. She is asking for sick leave for 3 days due to stress at work. Only. You examined her as normal. So what's the most important action? So here's a clue here, or the important to notice is that normal examination, young female teacher, stress at work. So what is the most appropriate? They give you a lot of options. You take the best, most appropriate or the best option. Is it giving sick leave or refuse sick leave? Or severe psychological factors and functional impact? Refer immediate psychiatry, prescribe antidepressant. So in this context, it might be, I think it might be the best one is, could be C, right? Let us see, yeah. So this might be the best, although some might argue that just the best is refuse sick leave, but because you need to be empathetic and helpful to your patient, so perhaps exploring psychosocial factors and see what is the cause of stress at work or at home, and how is it affecting her daily life. So that might be the option, best option. Let's go to another example. They gave you old man, smoker, who's coming for routine check. He has no special symptoms. So for routine check with this age, who is a smoker in primary care in Dubai, what is the best option here? Is it BSA for all men? Is it chest X-ray annually? Is it CT scan? Is it sputum? Is it PET scan? So according to my analysis here, is C. Is low dose CT check because they gave you his age and he's a smoker. So in this context, in the way, with this history, the best option to select here is C. In other areas, the best option might be BSE or BSA or something like that. But here, or sputum cytology, but here, in the way it might be a low-dose CT scan. Because he was heavy smoker, and according to guidelines in the way, as is 55 to 80, and they found that low-dose CT can reduce the lung cancer mortality. So it's a common question. This is another child of 2 years present with fever and cough, and there was no complete immunization. So the child was having fever and cough, and according to his history, no complete immunization. What is the most appropriate step? Is to give antibiotic or the X-ray, and or to do assess immunization history and red flags, admit to hospital, reassure only. In this context of this history, perhaps the best option might be C. Let's see this one. A 39-year-old office worker presents with chronic low back pain for 4 months. No red flags. So the key words here are the age and chronic, but no red flag. So the age is relatively young and it's chronic, but no red flag. So what is the best one to say? Is it to give best rest or to give long-term NSAIDs or to do MRI or encourage activity and physiotherapy or refer to neuropsychiatry? So in this context, because we know that MRI is not indicated because no red flags and also age, and long-term, short-term might be okay, but long-term, no. Bed rest has not been shown to be beneficial in this in low back without a red flag. So the best option here is D, as you can see. Let's go to another scenario. A 55-year-old on Amlor complains of ankle swelling. Blood pressure is controlled. Best next step, stop antihypertensive, Amlor, which is Amlor or amlodipine, switch to ACE inhibitor, add diuretic, reassure only, or increase the dose. So you can eliminate this one easily, and this one, and this one also. So remain to A and B to take one, either A or B. So putting in the account the age and Amlor and ankle swelling, and the blood pressure is well controlled. So what are you going to? Are you going to stop it or switch to? So the best is to switch to AC inhibitor. In Ramadan, a woman asking about fasting, why she is diabetic. So what's the role of GGP? Forbid fasting, ignore culture, risk stratify and provide safe fasting advice, refer to imam, stop all medications. So with this history, perhaps if you take into your account the background of the lady, she is diabetic, and the culture in Dubai, so perhaps you might only consider C. You cannot ignore the culture here. You cannot forbid fasting. So to respect her culture. Refer to Imam as this is not appropriate. So perhaps the best is C. Another patient who is angry because no antibiotic was given. So what is your option? Are you going to argue or give antibiotic or be empathetic, explain the rationale of not giving URT, not giving antibiotic, safety netting, ask patient to. The best option here in this context is C.